A dry cough is a type of cough that does not produce mucus or phlegm. It is called dry because it is not accompanied by the wet, productive sound associated with coughs that bring up mucus. Dry coughs can be caused by various factors, including viral infections, such as the common cold or flu, allergies, irritants, such as smoke or dust, environmental factors, or certain medications. In this video, we will look at the causes, symptoms and home treatments for dry cough. Allergies. Allergic reactions to substances like pollen, dust, mold, or pet dander can induce a dry cough as part of the body's response to the allergen. Viral infections. Respiratory viruses, such as those responsible for the common cold or the flu, can irritate the airways, leading to a dry cough. Medications. Certain medications, particularly those affecting the angiotensin-converting enzyme, ACE, or angiotensin II receptor, may result in a persistent dry cough as a side effect. Gastroesophageal reflux disease, GERD, stomach acid flowing back into the esophagus can lead to irritation, contributing to a chronic dry cough. Irritants. Exposure to environmental irritants, such as smoke, air pollution, or chemical fumes, can cause irritation in the respiratory tract and result in a dry cough. Asthma. In some cases, asthma can present with a dry cough, especially if there is no significant airflow obstruction. Please remember to hit the like button, subscribe and turn all notifications for our latest health and nutrition tips. The primary symptom of a dry cough is the cough itself, but there can be additional features or accompanying symptoms. These may include wheezing. In some cases, a dry cough may be accompanied by wheezing, especially if there is an underlying respiratory condition like asthma. Throat irritation. A dry cough can often lead to irritation or discomfort in the throat. Tickling sensation. Some individuals with a dry cough may experience a tickling sensation in the throat that triggers the coughing reflex. Sore throat. The constant irritation of the throat can cause soreness. Hoarseness. Persistent coughing can sometimes result in hoarseness or changes in voice. Difficulty sleeping. Coughing spells, particularly at night, can interfere with sleep. Shortness of breath. If a dry cough is severe or if it is associated with a respiratory condition, it may be accompanied by shortness of breath. Home remedies for dry cough. 1. Honey is a natural remedy that has been used for centuries to soothe coughs, including dry coughs. Raw honey. Choose raw, unprocessed honey for its maximum therapeutic benefits. You can take a spoonful of honey directly, or mix it with warm water, herbal tea, or lemon juice. Honey has natural soothing and anti-inflammatory properties. It can coat the throat, providing relief from irritation and reducing the urge to cough. Honey is not recommended children under the age of 1. It causes complication known as infant botulism or floppy baby syndrome. 2. Warm salt water. Gargles can be helpful in relieving the symptoms of a dry cough, primarily by soothing the throat and reducing irritation. Throat comfort. Gargling with warm salt water alleviates throat discomfort by diminishing inflammation and irritation. The warmth of the water brings a soothing sensation, while the salt imparts a mild antiseptic effect. Mucus thinning. Gargling with salt water aids in thinning mucus, facilitating its easier expulsion. 3. Steam inhalation and humidifier. Steam inhalation and the use of a humidifier can be effective in alleviating the symptoms of a dry cough by providing moisture to the airways and soothing irritated tissues. Moisturizing air passages. Inhaling steam or using a humidifier adds moisture to the air, which can help soothe dry and irritated air passages. Thinning mucus. Steam inhalation can help in thinning mucus secretions in the respiratory tract. 4. Ginger is known for its anti-inflammatory and antimicrobial properties, and it can be beneficial in the treatment of a dry cough. Contains compounds with anti-inflammatory properties that can help reduce inflammation in the respiratory tract. Prepare ginger tea by simmering fresh ginger slices in water for about 10 to 15 minutes. Strain the tea and add honey or lemon for additional soothing effects. Drink this tea 2 to 3 times a day. Thyme is known for its medicinal properties and has been traditionally used to help alleviate symptoms of respiratory conditions, including dry coughs. Thyme contains compounds such as thymol that have antimicrobial, anti-inflammatory, and expectorant properties. Here's a simple way to use thyme for the treatment of a dry cough. 1 cup of hot water and honey. 1 teaspoon of dried thyme leaves, or a few sprigs of fresh thyme. 5. Marshmallow root. Marshmallow root has been traditionally used for treating dry coughs. The mucilage content in marshmallow root is believed to have soothing and demulcent properties, which can help coat and soothe the irritated mucous membranes in the throat. Place the dried marshmallow root in a teapot or a heatproof container. Pour hot water over the marshmallow root. Allow it to steep for about 15 to 20 minutes. Strain the tea to remove the marshmallow root. You can drink this tea 2 to 3 times a day, especially when you have a dry cough. If your cough persists or is accompanied by other concerning symptoms, it's advisable to consult with a healthcare professional for a proper diagnosis and treatment. Please remember to hit the like button, subscribe and turn all notifications for our latest health and nutrition tips.